Hello and welcome back to the channel. You've joined myself, Dr. James Gill, for a clinical skills adjacent video. Today we're going to do the Q&A video we talked about recently in the community tab. Now previously we've done these with channel milestones, and they're as much a way of saying thank you to everybody who's subscribed to the channel, everybody who's made it what it is at the moment. Because let me be clear, I'm just a doctor shouting, how to use your stethoscope properly into the darkness. It's you guys that actually make this a channel that has usefulness for people, because you drive the things that we do. And to that end, with the questions and answers we've had today, they roughly split into three. We've got medical school questions, we've got medical questions, and life bits with a little smattering of Warhammer in there. So we're going to start off with the medical school questions, because I think they're probably going to be the most interesting to those of you here. So with that in mind, let's get cracking and we'll see what it is you wanted to know. So I've got the screen in front of me. Oh, I suppose I probably should have said, welcome to my office. So you've not seen this before. We obviously have a baby, and babies need their own bedroom. She's actually a toddler now, but that's by the by. So we had to move house. Part of that was that I now have an office upstairs here, and it's where, when I'm doing video consultations, this is what people see behind me. So welcome to the office. Okay, medical school questions. Shade.jade7 has asked, if you could go back to your first day of medical school, what advice would you give yourself? Would you do anything differently? I think that I would say, as I've said previously, sleep more. I struggled in the first year, and I think part of that was due to actually sport. I was rowing, and I was burning the candle at both ends, rowing late in the evening and then getting up first thing in the morning, and also rowing and then doing lectures. Sleep is colossally important with regard to your ability to absorb new information. And there's an interesting stat, I'll see if I can find where it came from, that a medical student, the lawyers would say they equally have this, but a medical student absorbs new vocabulary at the fastest rate of the entirety of their educational journey, apart from when they're between the ages of 2 and 3. That's how much new information we need to cram into. Yes, again, I appreciate the lawyers have a similar statistic, because, well, everything you're doing is in a completely different language anyway. But my point is that sleep will help consolidate that learning, and it's very, very important to getting through the year. So that would be the one thing that I would tell myself. You can't burn the candle at both ends. Don't try to revise late into the night. Set, define points and sleep. Get that 7 to 8 hours, because that's going to do you so much more good than trying to cram in at 2 o'clock in the morning, something that probably your brain's going to forget in a moment. Okay, Tony77723 says, was medical school difficult for you? I mean, the academic part, organic chemistry, etc. How much paper did you need to keep on hand? Yes, first year of medical school was very difficult, sufficient that I failed it. And I think that's the point. You can do very well in life by not being 100%. When it comes to medical school, certainly from my position now as associate professor, we're aiming to get the students to a minimally competent level. So that means that they're good enough. That means that they are safe to be on the wards. It means they're safe to look after patients. It means they are safe when they don't know what to do. They can work out a plan. And I think this is something that occasionally we get wrong at medical school. Students want to be the best. They want to know everything. A, that's not required, and B, it might actually cause them more problems. Seriously, just if you're struggling, aim for that minimally competent level. It's setting that we have for a reason. It's an attainment goal for you for a reason, and it would be wonderful to be the top of the class. But you get a medical degree, the very bottom of the class who actually graduated still got a medical degree. So sometimes if you're really struggling, aim for minimally competent. We put the requirement there for a reason. Okay, similar one, Louise Hornby, Q6E, has asked, any thoughts or advice on an 18-year-old about to embark on a medical degree? Given a time machine, would you still become a doctor? There's a question and a half. I think if I had my time again, I might think about going to dentistry instead. The problem is, medicine is a wonderful job. I spend my whole day helping people. I mean, realistically, what could be better than that? The problem is not the job. The problem is the work and the fact that there isn't enough time to do it. There's been a bit of a bleed with regard to the NHS in the sense that the NHS is free at the point of need. However, it's now being construed to be free at the point of want, and that's causing issues as well. My point is that there's not enough time to care for the patients that need it, and there's not enough time to care for the complexity as it should be. So everybody ends up working over and doing extra hours and things. Now, there's an argument to be said, great, just crack on. If that's what the patient needs, do it. But tiredness kills, literally. You want your doctors, your nurses, your clinical team firing on all cylinders. You want them relaxed and good to go. What you don't want them is coming off the back of a 12-hour shift, having driven an hour home, slept briefly, seen their family, and come back and done another 12-hour shift. That's the way that you get minimally competent care. You want your doctors to be striving for the best possible care they can do, and we're not superhuman. So yeah, that's why I perhaps wouldn't do it again. But if I say I wouldn't do it again, then the question is, who's going to fill in the gap? Medicine is a very sticky wicket at the moment. What I would say, again, the science, the knowledge you gain from it is fantastic, and the ability to help the patients is too. I'm hoping in the next few years that this might change. Okay, there were the questions about medical school. So let's put that to the side. Let's do the medical questions. Stammy2091 asked, would you consider expanding your library about expedition medicine? Yes. Later on next year, I've got an expedition to Norway and the Arctic Circle, which I'm really quite looking forward to. I'm very much a hot houseplant and not a big fan of the cold. So I'm sure people who've watched those expedition videos will say, well, hold on, you were at Everest Base Camp. Why on earth? Well, it wasn't that cold. There's pictures of me at Everest Base Camp in a very light, not very expensive, thin down jacket. I don't want to say coat. Now, don't get me wrong, I've got a massive, or took a massive, big, bright yellow down coat with me. I look like an angry bumblebee in it, and I barely needed it. So I'm hoping that I'm going to be able to take the cameras and hopefully deal with the battery life out there to hopefully get some content whilst looking at how to evacuate patients in sub-zero temperatures, looking at frostbite and things like that, and potentially the hilarity of me learning to maybe sled dogs and maybe use a skidoo. We'll see. It should be fun. Somebody, unfortunately I've clipped their name accidentally, my apologies for that, said, with people living longer, do you ever think we'll hit a natural limit to the human lifespan? Could the first person to become 150 years old already be alive today? Do you even think true immortality is something we might see in our lifetime? Would people even want to live that long? That's really philosophy. I'm not sure about. I'm the one to answer that. But I'm going to pull one of my colleagues in, Andrew Stein, Doctor of Renal Medicine. It was very clear when I was at medical school that one of the main limitations with regard to ageing is the kidneys. If you can improve everything else, your kidneys will just keep steadily progressing in a downward trajectory until that's it, game over. So if you are looking to extend the lifespan, a huge proportion of that is going to be, how do you protect the kidneys? And the extension to that is, would you want to live to 150? We are very good with modern medicine about keeping the body going. We're very bad, I think, at helping people live better. And that's a major thing. look at the nursing homes and things like that. There's a large proportion of people there who are alive, but there's an argument to be made that are they truly living? And maybe that's one of the things that medicine could do in future. Focus less on extending the lifespan and more about extending the number of quality life years. You know, if you can live to 80 and go running and, you know, play football and cycling and all those things, surely that's better than getting to 100 but having, you know, been relatively limited in what you can do by the age 70, for example. There's no easy way to answer these questions, but yes, I do think that we're going to be getting the further life extension, potentially, but it does rely on the question of whether or not that's the right thing to do. And the question should be, how can we actually improve the quality of life of people before it becomes just a numbers game? So Mike D1S9E asked, my most burning question on neurodivergence is, what do you think about the label of autism spectrum condition as opposed to autism spectrum disorder for those that meet the underlying genetic brain wiring and exhibit the same behaviours but don't cross the clinical thresholds? Honestly, my feeling on a lot of these things is that labels are unhelpful. Now, don't get me wrong, people fight for their diagnosis of autism and Asperger's and things in order to get the care and changes that they need. I think that if we're in a society that only makes changes when there's a label attached to it, it isn't doing very well. If somebody needs kindness, then let's look at giving them kindness. You know, what does a person need, you know, reasonably in order to be able to flourish? If it means that we need to present the educational materials in a different fashion, that's on me, not on them. You know, you wouldn't go to a patient who has knee pain but with no specific diagnosis to it, oh well, never mind. You'd still want to help that patient, whether or not that's with physiotherapy, you know, looking at their shoes, looking at painkillers. You want to try and help that patient. Just because somebody lacks the label of autism doesn't mean that we shouldn't attempt to be reasonably accommodating for them. And I do think that there is a to and fro thing with that. It's that reasonable accommodation. You know, are you being, you know, requested to put an unreasonable amount of resources to one student? In which case we might have to look at whether or not that's actually a viable option. But if it's just, you know, treating somebody with respect and, you know, trying to adjust some things to make their life better, where's the harm? So yeah, I think labels can be problematic and we should actually just be treating people with respect. I think that's the big issue with the autism discussions, if I'm perfectly honest. Cheese_epic asked, what annoys you most about medical things in TV shows? Is it the thing like the defibrillator being used to restart the heart? Yes, yes, yes. I hate it that the defibrillator is the magical on-off switch for people. Drives me up the wall. Bandages being able to cure gunshot wounds by themselves within a few hours, or some tiny detail that always annoys me when you see it in fiction. Yes, actually, the thing that annoys me in fiction is that people are either A, overpowered, or B, underpowered. I couldn't think of a good example. The first thing that came to mind was Monty Python. But, you know, the Black Knight loses all his limbs and he keeps on going. You know, from a pain perspective, should not be possible. But conversely, the number of people who get stabbed and that's it, game over, they're dead. It's like, no, that's a stab wound. That's really, really serious and really, really damaging and really, really painful and potentially really, really terminal, but not going to be terminal in 15 seconds. That really drives me up the wall. Similarly, the way that you can have a gunshot and seemingly to be entirely indifferent to it. Often I'll look at where someone's been shot, typically the shoulders, and it's like, that arm's not going to work anymore, and they keep on going. Sometimes medicine does stop the suspension of disbelief and can make watching things somewhat challenging. Okay, so they're the core medical questions we've had. Let's have a look at some of the generalised ones. Peter Surplus 4306 asks, I'm curious to know how often you get recognised for your YouTube videos, and are there strange or awkward situations out with your family? Honestly, no. Everybody is to a point incredibly polite whenever they've seen myself, Beth or Felix out. We were walking in London the other day, we were going to see the Jurassic World exhibit, and a chap was on the phone to his parents, who weirdly enough are also doctors, saw us walk by, sort of double take, and we heard him, say, I've got to go, and then, sort of introduce himself. But my point is that most times we've seen somebody, they've always been incredibly polite, and I've always been grateful for somebody saying hi. That said, the best I've ever seen, I was in Scotland and I intended to run Arthur's Seat, which for those of you who don't know is like a massive community park with this huge rocky outcrop in it. It's probably about 5k around. And I saw this guy finish the run and he was puffing and panting, and I wandered up and said, hey, you look like you did very well, what was your time? And he looked at me, covered in sweat and panting. Dr. Gill? It was the bizarrest sort of meet-up I've ever seen. But yes, I have been seen in some strange and awkward places. Cultash asks, will Megan come back to be your willing test subject? How's Abby getting on? Hopefully everybody's well. Maybe, never say no, but one of the things that I say is that I'm doing this to try and help people, and often the students who work with me are essentially getting time and as many questions as they want and a bit of focus examination training. So Megan is passed with flying colours, so I presume that she won't be coming back. That said, I like to consider them all friends, and you never know who might be coming back in the not too distant future. We'll see whether or not something transpires, but the difficulty is when people have moved to work in the south of the country, for example, it can somewhat be challenging, but we'll see. Used Lamp 1, which is a very entertaining name, asked your favourite Chaos faction and what piece of medical equipment. I thought I'd go for a bit of both. Is that talking about Warhammer? Honestly, I suppose if we're going to Chaos, it's going to have to be 1,000 Suns and that side of things, because they're very cool models and they're driven by science. I'm a scientist that went to medical school, although there are also a bit of magic in there, but let's not go there. So yeah, I like that. And in terms of my favourite piece of medical equipment, that's a really difficult one. If we're talking about clinical skills, I think it's a tuning fork because of what it allows you to do with regard to fractures and things like that. But conversely, that probably also means that the X-ray is my favourite bit of medical equipment because it's so useful to patients in so many different ways. Oct-I says, greetings, do you read any books? Specifically, do you read philosophy? And if yes, what authors? I wish I was bright enough to say yes, I read philosophy. No, I don't. I actually found that medical school largely stopped me reading for fun, but thankfully that has changed now and I'm getting back into my books and things now. The one series that I would recommend to anybody if you've got even a slight fantasy bent, the Dresden series. It's honestly just fantastic, and the audiobooks are read by James Masters of Buffy the Vampire Slayer. Honestly, Jim Butcher's The Dresden Files are fantastic. Now, my wife was quite objectionable to those books. She really didn't like them to start off with because she comments that there's a lot of male gaze in it. My argument, being 18 books further down the line compared to her, was that it is a thing of the character and to stick with it. And she did. We've listened to the audiobooks when we're on long drives because they are just phenomenal. And 4 or 5 books in it, she got the bug. She began to love the character, even for his male gaze, which is part of his flaws. And they are just tremendously written books, and I am actively waiting for the next one that comes out next year. So yeah, check out the Dresden series. Lewis Horseman 2219 asks, do you have a poster of Fabius Bile in your bedroom? No, but he is very cool. I rarely have time to play Warhammer. However, what I do play is Necromunda, and I do have the doc, unsurprisingly, in order to bring back my guys from their serious injuries. But no Fabius Bile. Tyron313 says, nice skeleton. We recently found a real medical skeleton from the 60s in my grandma's basement. We thought it was fake at first, but compared to what you have, it's definitely real. Yeah, when I was at secondary school, actually, we had a real skeleton there as well. There was a trend, probably in the 60s, I don't know exactly the time frame, when families from less well-off countries would sell the skeletal remains of their relatives in order to make money. I mean, I can't imagine how difficult that would be for some people. I'm glad it's not something that carries on now, but yes, Bob, my skeleton, he was bought for me when I found I got to medical school, so he's been knocking around here a long time. And yeah, I'm very glad that he's just resin. I'll see if I can dig it up, but any time that I've moved house or moved rooms or something like that, Bob always gets put in the passenger seat driving along down the road. I used to have a little Fiat Punto. We got some real looks going through the traffic lights with him, sat there, skeletal arm on the open window. But that's a different story. Okay, final one then, and I've saved this one intentionally. Mary Kiwiki. What's the best advice you have for someone who's scared to explore because of ill or getting hurt? That's a really difficult one because I don't know each person's situation. What I would say is that pushing yourself in some way, shape or form, in a way that is safe, is always going to be better for you than not having done it. Having spent a lot of time with people who are dying, people never regret the things that they did. They always regret the things that they didn't. And from my perspective, I've done quite a few daft and silly things in my time, some of which have been moderately scary. But those things have always been within what I would consider to be my capabilities. Outside my comfort zone, yes, but it's like, do I think that I can do this thing? Yes, I should be able to. Well, I should be able to do it, so let's try and do it. So start off small. If you're worried about getting ill and things like that, part of that to me might suggest an element of confidence, probably based on real world experiences previously. But what you can do to try and build your confidence to do more is, in small ways, push the needle. So for example, if you're worried that doing too much exercise is going to cause you problems, go speak to your doctor, find out where that concern comes from and if there's something that can be done to mitigate that. There's always something that we can do to improve the quality of a patient's life. I've never found a patient that we can't do that for, and this sounds very much like that. You want to get out and do things, well, speak to your doctor and see what it is that you feel is limiting you and see how you together can come up with a plan to potentially push yourself in a safe way and do more. Well, that's the end of the questions that we got there. I hope this has been a useful distraction, verbal monologue, however you'd like to describe it. We'll be returning with some more things, much more focused clinical skills shortly, including the mitral stenosis video. But again, thank you to you guys for allowing this channel to stand up, and thank you for all the feedback that you give, and particularly the people that share their stories on the comment section here. Some of them are so moving, and similarly, the way that the community always rallies around these people and is so supportive, I could not have imagined the environment and, I'm going to say it again, the community that you have all made here. Thank you for that. With that in mind, take care. I'll see you in the next one.